So now we're going to hear from Legal Aid, New South Wales. We have Eliza Hull from the Domestic Violence Unit of Legal Aid, New South Wales, and Florence Cruz Montalvo from the Refugee Service and the Family Law Early Intervention Unit of Legal Aid, New South Wales, with us today. So thanks, Eliza and Florence, for joining us.
Thank you.
And we'd like to start with a question about, are there any changes in the way Legal Aid is supporting clients with restrictions starting to ease?
Yeah, so it's Eliza here from the Domestic Violence Unit from Legal Aid, and I'm going to do the first two questions. Firstly, I'd like to acknowledge the traditional owners on the land of which we meet and pay my respects to the elders past and present. I'd also like to acknowledge that I'm actually on Dharawal land in the Illawarra region, and I work down in Woollongong as part of the Domestic Violence Unit. So in relation to the first question, I guess as for everyone, this has been a very challenging time for Legal Aid. Legal Aid was very quick to stop face-to-face services with clients, and we transferred all our services onto an online platform very quickly. As the restrictions are easing, Legal Aid is working very closely with external stakeholders such as courts, the WDV CAS, police, and the people who are presenting here today, to ensure that we can provide effective legal services to our clients and continue to comply with the COVID-19, I guess, restrictions as we ease back into a face-to-face service delivery. So what's that kind of looking like for Legal Aid is that from the 1st of July, our offices will be opening to the public. However, staff will continue to work from home if they can. So there'll be no longer any kind of drop-in clinics for Legal Aid clients, and it will be all continuous telephone advices as we kind of go along. There is a lot of planning going on in the background for Legal Aid on how we kind of deliver our services, and that's kind of happening as we speak. So I think that will become a clearer picture as time goes by. I guess from a on the ground perspective, as a lawyer working for Legal Aid, the challenges that I think that will come out of easing back into kind of normal life for someone like myself or Florence in relation to seeing clients and supporting clients is how we're going to safely provide those face-to-face services. For the Domestic Violence Unit, a lot of our services are duty services which involve us attending, for example, the local court to assist the WDV CAS to support victims who are dealing with AVO matters. I think that there's going to be lots of challenges in how we're going to do that safely in the future. For example, there's a lot of safe rooms across the courts in New South Wales, which are very small, and we're only going to be able to, I guess, see a certain amount of clients in those safe rooms. There's only going to be a certain amount of people allowed in those safe rooms, and I think that that is going to be one of the major challenges, I guess, for the Domestic Violence Unit in servicing our clients, because I think it's very important to have face-to-face services for victims who are dealing with these issues, and it's imperative, I guess, to be able to be at court and speak to the client as things are happening very quickly at court. So I think that that's one of the major challenges. This is, I guess, as everyone has kind of discussed already today, an ever-changing environment. So it's really about keeping up to date with what's happening, keeping up to date with the restrictions and the easing of those restrictions, and working really closely with our stakeholders to ensure our clients are kind of supported. And I guess the whole thing is very challenging.
Yeah. Are you still seeing an increase in domestic and family violence contacts and referrals coming to you?
Yeah. So the short answer is yes. The Domestic Violence Unit, since COVID kind of hit in March 2020, has received around 14,000 phone calls and referrals, and over 800 email referrals in the last few months. To provide a bit of perspective on that is that generally the Domestic Violence Unit will receive around 1,000 referrals via telephone annually. So that's been a really significant increase for us. I think that that has a lot to do with the fact that our service delivery has changed quite significantly, and we're delivering services via telephone or virtual means. So I guess there's a correlation there. But from a perspective of working in the sector and working for the DVU, I can say that we've definitely seen an increase in DV referrals. These include increase in people asking advice about family law, AVO matters. We've seen a lot of AVO variation matters coming in, which may be a reflection of those legislative changes that kind of hit initially, that the police were discussing earlier about the 6 months, the provisional orders being in place for 6 months for certain AVOs and things like that, and victims wanting the ability to change those. We've been seeing credit and debt issues coming through. We've been seeing a lot of victim services matters and care and protection matters coming through as well. So the short answer is definitely yes, we seem to be seeing an increase, and a consistent increase over that 3 months. It doesn't seem to be slowing down by any means.
Do you think in some ways being able to access you or doing it over the phone or online or whatever has actually been a positive in that respect then?
I think that it has allowed for a lot of clients to access us who wouldn't usually access our services, and I definitely think that that's a positive. I recall that I've dealt with a lot of clients from regional areas. For example, I think I had a client from Gunnedah and Cobar, so kind of like far west regional areas who wouldn't necessarily access our services have been able to access our services. I mean, they've always been able to access our services, but I guess maybe there's more word of mouth around about how you can access the domestic violence unit. So I definitely agree with that there's a lot of positives coming out of this coronavirus situation, I guess, for our clients, as well as negatives.
So this could be something that will continue, do you think, even when you're back to face-to-face?
Well, yeah, look, I'm not sure about what exactly will be happening, but there's definitely a lot of planning going on at the moment from Legal Aid in relation to what services have changed and how that has worked and how it hasn't worked, and how we can move forward in the future by taking on the positive aspects of what has worked for our service delivery during coronavirus. So I would imagine that, you know, it may be above my grade, but there's people in Legal Aid who are doing all of that planning at the moment, and I'm sure we'll definitely see some significant changes to the service delivery.
Yeah, maybe before we go to Florence with the other questions, maybe if there's some questions from the chat for you specifically, Eliza. Maria, could you?
Sure.
Sure. Okay. One question was, what about people on bridging visas or temporary visa holders? Are they able to access support from Legal Aid? So they might be in a refuge and with children as well.
Yeah, there's no issue with clients who are on visas accessing Legal Aid. We assist clients on visas all the time who are needing Legal Aid services. There's no requirement that you have to be, I guess, an Australian citizen for Legal Aid to assist you.
Great, thank you. And then you said that there was an increase in calls and things like that. Is there or are you noticing a change in the types of abuse that people are presenting with?
That's an interesting question.
I'm mindful that I guess that people might present with physical abuse, but then now it might be much more underhand, like financial or verbal.
Sure. I guess that's a kind of a hard question for me to answer, because I work at the domestic violence unit, where consistently seeing lots of variations of family violence coming through. I haven't noticed any kind of specific avenue of family violence being more prevalent during COVID, but that you know, that's just from my experience. I'm not sure if there's something kind of specific that is happening. I think people are kind of, I guess, it's more in victims' faces. So, for example, the perpetrator isn't going to work every day. So therefore they're experiencing the family violence more consistently, which may be why they're accessing the services. But there's not really a specific element of family violence that I'm seeing any more prevalent during COVID.
Thanks, Eliza. And I guess if we have a bit of time when we finish, we can ask you a few more. But we might move on to Florence now. Florence, what legal assistance is available to a parent during this time who needs an urgent parenting order or who's having problems with the arrangements for their children because of COVID-19?
Thank you, Sue. I'd like to begin by acknowledging the which we meet, in particular the Darug people, who are the traditional custodians of the land on which I'm working today, and I pay respect to elders past, present, and emerging. Now, the COVID-19 pandemic has resulted in a lot of services, including the courts, reducing or suspending their face-to-face services. As Eliza has mentioned, we're still providing legal advice and assistance, but now delivered by telephone. This includes our duty service, which runs Monday to Friday from 9:30 a.m. to 4 p.m. with a break between 1 and 2. And parents who have an urgent family law issue can contact our duty hotline on 1-800 551 589 to speak with a duty solicitor. So we are still assisting with urgent applications to the court, such as urgent orders for children to live with a parent when the child is at risk, or to get a recovery order where the other parent has retained the child from the primary carer. There is still the opportunity for our duty solicitors to provide assistance with court matters and provide duty representation, as we did when we had our face-to-face service in the court, but now that service is being delivered by telephone as well. So understandably, parents have been concerned about the safety of their children, especially if their children have a pre-existing condition, and whether or not to facilitate time between the children and the other parent during this period. So parents are encouraged to act sensibly and reasonably during the time. Those are the encouragements by the court in particular. If there are court orders in place, there is an expectation that they will be complied with unless the child will be. If parents are having issues with the arrangements for their children because of COVID-19, because the other parent isn't facilitating time anymore, or they're concerned about sending the children to mum's place or dad's place because of the coronavirus, then they are encouraged to get legal advice as soon as possible. Legal Aid New South Wales has established a fast-tracked process to arrange mediations to deal with specific issues arising from the pandemic. These mediations are usually arranged within 2 weeks, and parents can call our duty hotline, or they can contact Law Access on 1300 888 529 to speak with one of our family law solicitors to see if this is an appropriate course of action for them. Now, with respect to the courts, they also have established some particular measures during this period. They established a national court list on the 29th of April, it was, to deal exclusively that have come about as a direct result of the pandemic. So, for example, where there are orders in place that cannot be complied with because of the state border closures, or contact centres being closed, or because of an increase of family violence because of the restrictions. So applications that meet that criteria, they're listed before a registrar or a judge within 3 business days. We have received feedback from the court that has been quite positive in relation to the lists in terms of how streamlined it has been for applicants to make this application. So although we're now seeing an ease in restrictions, and we expect that, family law issues directly impacted by COVID-19 will also see a reduction, all of these processes are still in place and available to resolve parenting issues that arise because of the pandemic.
Right, thanks for that. The other question we had was more about the CALD community, and looking from the legal point of view, what legal support and resources are out there for the CALD communities who might experience linguistic or cultural barriers during this time?
Yeah, so it's important to note that all of our legal services are available to who are culturally and linguistically diverse or on differing visas. We provide telephone interpreters for free, especially during our advice sessions, to reduce language barriers. We also aim to work in a culturally sensitive manner. Legal Aid have a large volume of clients from a culturally and linguistically diverse background or a refugee background, so that's very important for us. Clients can contact Legal Aid New South Wales through the TIS hotline, so that's 131 450 to speak to us already with an interpreter, or they can call us and then one of our reception staff can actually patch through a telephone interpreter. For persons who are recently arrived refugees, so they've been in Australia for less than 6 years, they can contact the Refugee Service on 87136725. The Refugee Service is a specialist service dedicated to assisting clients with their family law issues and civil law issues like housing and Centrelink and debts. We have an Arabic speaker working in the Refugee Service, and she answers the hotline Mondays, Wednesdays and Fridays. Now, with respect to legal resources, Legal Aid New South Wales has a variety of publications on various legal issues available in language. These can be found and retrieved through our Legal Aid New South Wales website. We also have fact sheets on COVID-19 issues. I don't believe these are in language, unfortunately, but community organisations can contact our community legal education team and request a CLE in language for any of their cold groups to talk about COVID-19 related topics. So we're always happy to do that. And I've actually done several CLEs with an interpreter, you know, Arabic, it's usually an Arabic interpreter or Arabic speaking groups that request these, but we can have groups for all different types of people from a core background. Yeah.
Fantastic, thanks. Have we got some more questions for Eliza or Florence, Maria?
Yes, we do. So Eliza, I see that you've already answered some of the question from Isabel, but Isabel had a question about her client. Client's an Australian citizen, has a pin-up in an AVO. The husband is on a bridging visa, applied for a spouse visa, and is on assault charges. But they're worried that this might change the visa application, therefore he may need to return to his home country. The concern is that they've got 2 young children. Eliza, you said that they need to obtain some legal advice. Is there anything further you'd add to that?
Well, I would suggest that both the client and the husband obtain independent legal advice separately. Legal Aid have an immigration unit that the husband could speak to in relation to his visa and what his criminal or how his criminal charges may affect that visa. So that's not necessarily something that I would do, but it's definitely something that the immigration unit at Legal Aid would be able to talk to the husband about. And then in relation for the pin-up or the victim, depending on the situation, the parties, if they want to stay together, then they may not need to get any family law advice or family violence advice. But if the victim did want to separate from the husband, then there may be a need there to seek out some family law advice and things like that. Florence, is there anything you would add?
No, I think you answered it brilliantly.
Thanks so much. With the economic outlook reflecting an increase in joblessness and going by historical trends and instability, are you seeing a likelihood of continued increase in abuse and violence with the stress of joblessness?
I can only assume that yes, going by historical trends, that is something that unfortunately we may see. But I guess in saying that, there are a lot of support services here today. There's a lot of amazing people working in this area, and hopefully we can all work together to if those increases are occurring, to at least support victims and perpetrators through these issues. But I assume that will be the case.
Thank you. Yeah. And have you seen, and I guess there's been a comment that there's been a lot of clients who are now in total isolation and they can't access the clients because the partners are doing the shopping and taking kids to school and things like that. So there's some people who haven't been seen for weeks. Are you noticing that? And can the general community and us in our roles do anything to connect with them?
Yeah, I think that that's definitely something that is happening. We have had clients who will call us when the husband is out, and you know, there are lots of measures you can put in place for your service to ensure that you can speak to that client safely. For example, at the domestic violence unit, which I'm sure all the services do, is that we have a text before calling kind of position. So if the client requests it, we will text them before we call. If in the event that these issues are happening, we'll make sure that we've got a time that we can call the client that's going to be safe. There's also, it is really difficult at the moment because of this isolation issue, and accessing those clients. Again, they may not even know how to access our services, so it's really difficult. But if you're putting in as many measures as you can to keep that client safe and ensure that the partner isn't going to find out about the client's issues initially anyway. We've also got the family advocacy support service and social workers at the domestic violence unit who assist clients doing that first initial kind of leaving the relationship, which we know, I'm sure if you are all aware, is one of the most dangerous times for a woman to leave. So I think if we've got clients surrounded with support services during that time and we're putting in measures to keep them safe, that's really important. But yeah, it's an issue that we've been seeing at the DVU, definitely.
I just wanted to add, you know, I've seen an increase in community workers doing referrals and helping with arranging appointments for their clients. And I imagine it's because the family have already engaged with that service. There's nothing untoward with the, you know, settlement caseworker or just a caseworker from an MRC going into the home or talking to them. So I've seen an increase in referrals from community organisations, and I would just like to say that if you can help clients, you know, reach out to us, and you can send emails or call on their behalf and let us know when it's a safe time for us to call the client for the appointment and help us arrange that appointment. That's always very helpful.
Great. Wonderful. Thanks very much. That's it from me.
Thank you. No more question from your end. Thank you very much, Eliza and Florence, for providing that kind of information. It's really valuable, I'm sure. Domestic violence lines, it's a very essential services, especially during this time. And we have Kim Durus, the assistant manager from the domestic violence line, to joining us and provide some information. So welcome, Kim. Again, we would like to find out about an update. So the first question would be, what is the current impact of COVID-19 on domestic violence lines? What do you see as the main challenges as the situation is changing?
Firstly, I would like to acknowledge the traditional owners of this land we meet on today, and I pay my respects to elders past, present and emerging, and for our colleagues who are with us in this webinar today. And I'd also like to thank Adol for allowing us to be a part of this presentation today. So just a bit of information about our service. Our service is a statewide 24/7 crisis telephone service. So under the COVID-19, we've still continued to operate as an essential service as we normally would. How obviously the work we do is different with our callers. So we work with women with or without children who are experiencing violence and abuse from an intimate partner, past or present. So we're co-located with the Child Protection Helpline. We're a relatively small team of about 14 trained caseworkers. Since COVID-19, one of the challenges for us is to move staff to work remotely. So most of our staff are now working from home. In terms of our call data in relation to COVID-19, I think Alana said before, we haven't necessarily seen an increase in calls as a result of COVID-19, but however, our calls are up in relation to calls we would receive at this time last year. Since this time, so yeah, I think I need to, so our number is the 1800 656463. So we're a New South Wales statewide service. Often people ask the difference between our numbers. So 1800 Respect is the national service which provides counselling only. We also work closely with Link to Home, however, they're accommodation provider. So our service, if we have a caller who is experiencing intimate partner violence, we're able to provide both the counselling and accommodation support. In terms of COVID-19, obviously the area of domestic violence, as you know, is a complex area. So we have a significant number of callers who experience substance abuse or mental health issues. And it's important for us to make accurate assessments so that we can determine what their needs are at the time of calling. So our service also offers accommodation. So during the COVID-19, we've continued to provide accommodation for callers once they've made a decision to leave a violent and abusive relationship. We're still working with refuges as a first point of contact, because we know a supported move once she's made a decision to leave is a better decision and outcome for her. So refuges are still receiving referrals, however, they're not taking referrals so they're at capacity. So they're trying to maintain social distancing, so not sharing bathrooms, and they're also doing general health screens prior to accepting a client. So, you know, the general flu-like symptoms, have they been exposed to COVID-19? What we're also doing is we still provide temporary accommodation, which is accommodation through Link to Home, and we would access that rather than have the caller ring Link to Home. So under COVID-19, we're now offering 5 nights as a standard TA, and what we do is request that the caller ring housing rather than present to the office to have that extended. What we're trying to do is that we see a significant number of women who have little access to food or items for children. So what we're trying to do is place them in supported TA where they do get meals and other support. If we're not able to do that, then we're able to provide assistance under our brokerage, but that's generally time limited, so we need to have an outcome. Once we've placed them in a temporary accommodation, what we do is link them in with a domestic violence referral enhancement service. That can look quite different depending on where you're located across the state. And the idea of that service is to provide more of a case management service. So since COVID-19, these services are still operating, however, they're not doing face-to-face visits, so it's more telephone support. We also have a referral pathway with our interstate colleagues. So we have received quite a few requests during this time for women escaping violence to move to other states. And that has been in some occasions difficult given borders are closed. So I think generally our caseworkers are working with callers in terms of just giving them someone to listen to, someone to talk to, and someone to help them, you know, planning next steps, you know, and that may be as a result of, say, increased mental health due to isolation. So, you know, talking with them where they're at and then referring them to an appropriate service.
Okay. Do you have advice on how to support someone who is a victim of domestic and family violence when the perpetrator is working from home, which limits contact conversations with the victim?
Yeah, certainly since COVID-19's restrictions have been in place, an important part of our work we've been doing is around safety planning with our callers. And I think it's important to acknowledge the complexities and the dynamics of domestic violence, and that a lot of our callers are already feeling significant isolation, lack of connection to the community, particularly when we're talking about our regional callers and our, say, CAL background callers. So in terms of COVID-19, in some cases, it's been a similar response. But we've also seen an increase in people obviously strained within a relationship from being within the home. So I guess it's important for us to determine what is a violent and abusive relationship versus what is a relationship breakdown or a stress on a relationship. So, and I think that the degrees of the abuse women say, for example, verbal abuse, we have callers saying, look, I've been in a relationship for 30 years and I just can't take it anymore, because he's around more often and it's just increased in terms of the verbal abuse. I need to leave. So in terms of safety planning, since COVID, obviously we've been still engaging with callers whilst the perpetrator's in the home, and our first step is always to identify safety. So if there is immediate safety issue, what we would do is call 000. If we're able to engage in a conversation, what we would do is, ask her if she can move to a certain place in her home whereby we could have a private conversation. Is she able to go outside for a walk? Is there a time when she can go out and she can call back? Can she sit in the car? We've had some counselling calls in that scenario. And it's also about developing safe words. So if it becomes unsafe, the use of different words, or also, you can hang up and call back our line at any time. We certainly have no limits as to how many times people can call our line. And I think cyber safety has always been an issue for women who are experiencing DV. So again, it's around, just doing a bit of questioning around, does he have access to your phone? Is he listening to these calls, and managing those the best we can. And I know some of our caseworkers have actually done some mediation work with the perpetrator and the victim.
We also want to know whether the DV line is, or whether do you have many called women from the northern region accessing or contacting the DV line for support?
Yeah, certainly one of the things that our call data indicates is what we know about domestic violence, that it doesn't discriminate. So in terms of our data, we don't necessarily have one specific group calling. We see all different COLD backgrounds and ages and socioeconomic backgrounds. In terms of the COVID-19, one of the big restrictions we've had is around women who are experiencing visa status issues. So under the temporary accommodation, those callers are only entitled to the 5 nights temporary accommodation, and it's unlikely that that's then extended through housing. So this already is a big area, we're trying to work through in general, but it's about working harder to try and get those women into refuge placements or exploring what other options they have within the community in terms of ongoing accommodation and support. In terms of the northern area, we do receive a lot of calls from the Chinese community.
Just lost Kim.
Hello?
Are you there?
Hello?
I'm here. Can you hear me?
Yes, we just lost you for a second.
Okay. Can you guys hear me? Can you hear me?
Yes, I can.
Okay. My final question is, we just wanted to have an update on the current impact of COVID-19 on child protection services. what are the best way that services can support children and young people at risk of domestic and family violence due to perpetrators working from home?
Yep. Certainly, I'm speaking from a child protection point of view, but I'm not currently in a child protection role, but I have had experience in child protection, and certainly being based with the helpline, I was able to seek advice from them. So child protection has continued to provide services during the COVID-19 as essential service providers. Like others who have continued to do face-to-face, caseworkers take precautions to ensure that they're not placing themselves or families at risk, as guided by New South Wales Health. This is usually through screening questions with the family to assess if there may be COVID-related illness within the household. Where home visits are not essential, staff have been conducting some of their work through use of many technology platforms we have available. So I know one of the things that people have been doing with young people, for example, in terms of engagement, is talking to them through FaceTime. So when children weren't at school, caseworkers worked closely with schools and families to ensure that children and family were involved with supports and not isolated. The Child Protection Helpline continues to receive and process risk of serious harm reports. Reporting continues to remain steady, both for mandated and non-mandated reporters. And the face-to-face assessments when required. Now children have returned to school, there's a greater visibility and there's an option for them to disclose and access support, which they weren't necessarily able to do whilst they were working from home. And services involved with families are still maintaining contact with the families. Child protection workers in general engage with the whole family during assessments, and where domestic violence is a concern, this includes working with the perpetrator and developing safety plans. Child protection services work closely with police and NGOs to make sure families have the right services involved to keep women and children safe.
Yes. Is someone talking about that? That's my echo. Thank you very much, Kim, for providing the information. Just I'll hand it to you, Maria, just if there are any questions from the audience for Kim.
None have popped up on the chat, but I did have one in terms of what's happening with the easing of restrictions. So what are your concerns about in terms of as we ease those restrictions and come out much more in public and things change?
I think that it's going to give women more of an opportunity to seek support who are experiencing violence and abusive relationships. And I think that just as services start to open, you know, like we've heard today with court support and things, it will give them a better opportunity to be able to talk to someone about what's happening for them. But certainly in terms of for our line, you know, it's still a phone counselling service. So we would continue as we normally would. But hopefully for some women, because I know there's been a lot of fear for women in terms of leaving the home as well with the virus, that they haven't wanted to go to, say, pick up essential items they might need like food, or they haven't wanted to seek accommodation because of fear of the virus. So I think that that's added an added extra layer of abuse for some women in this situation. And I think for me, and just wrapping up, I'd like to, I guess for us, we get a lot of calls from within the community, and it's important for us to make accurate assessments as to what a woman's need is, particularly when there's mental health issues or there's drug and alcohol issues, or the woman's being injured, say for an attempted strangulation, or she may have healthcare needs. It's important for us to be able to provide that information to other services so we can work collaboratively as to what's the best place for her to seek assistance at that time.
Great, thank you. So that's a helpful thing for us to know in terms of how we liaise with you as well and recommend them to call you and pass on that information. Thank you. That's it for me.
Okay, well, thanks, Kim. So our final speaker today is Brooke DeRoss, who is joining us from the Northern Sydney Local Health District. And Brooke is one of the domestic violence officers with the LHD. So thanks for coming, Brooke. Our first question for you is that what health support is available for victims of domestic and family violence? And is there any impact on access due to the current situation?
I think I'm on now.
Yes, you are.
Okay. Hi, Sue. Thank you so much. And thanks, Adele, for having our service here today. So as Sue said, my name is Brooke DeRoss, and I am one of 2 domestic violence officers located in the Child Protection Service at Northern Sydney Health. And I would like to start by acknowledging we are meeting on Aboriginal land and pay my respects to elders past, present and emerging, and any Aboriginal workers participating here today. Just bear with me, I have to refer to my notes because my job is district-wide across the whole of Northern Sydney Health District. I just want to make sure I'm able to feed back all the consultations that I had with different health services across the district. I don't want to miss anyone's great work out from this webinar. So like many services during COVID, lockdown restrictions have brought new and challenging times to health clinicians across the district, delivering care and support to some of our most vulnerable families experiencing violence and abuse as services transition to working remotely. So probably like a lot of services here today, there are a lot of challenges transferring to technology, you know, accessing video conferencing platforms and being able to use that technology with clients at home. We were advised by the Ministry of Health that we weren't allowed to complete the mandated domestic violence screen remotely as it may not be safe for women at home. So that presented a new challenge to health clinicians in terms of identifying and responding to domestic violence. Our clinicians advised that one of the biggest challenges for them is when they got new referrals for clients that they had not previously engaged with or met before COVID. This was really challenging for them in terms of having to contact these clients, vulnerable people, remotely, and try to form a connection, engage them, and bring them into the service, because as we all know, trauma-informed care relies very heavily on providing an environment where clients feel safe, they feel trust and connection. But this was very difficult to achieve without being able to meet the client face-to-face. Some clients advised clinicians that they preferred the move to working remotely as it offered more flexibility and ability to engage with healthcare services. Drug and alcohol, gambling and mental health counselling services fed back that sometimes their clients felt shame about their addictions and that talking on the telephone as opposed to face-to-face made it easier for them to open up and talk about what was going on. However, for our really vulnerable families where there were significant concerns about safety and well-being of women and children, moving to online and remote has created further obstacles and challenges in being able to reach and engage and connect with these families. Clinicians reported that conducting risk assessments and managing risk at this time was really challenging, difficult and really worrying for them. We had several clinicians commence new roles within health at this time, and it was extremely stressful for them to navigate not only a new role, but also to provide support to clients on their new caseload. So really well done to the new clinicians that have started within health during this really challenging time. And also, I think in terms of for the health clinicians who were working remotely, the worry of holding stress and risk without having your colleagues within easy reach to kind of turn to, you know, normally we have that luxury in health where we're sat next to our colleague who we're able to just turn and have a bit of a debrief to and say, hey, that was a really intense phone call, or I'm really concerned about that family. So whilst there was remote support available, there was a lot of clinicians at home working remotely who were really you know, finding that really stressful and worrying for them. There was the added layer in terms of working with our key stakeholders and partners in terms of DCJ and family referral services who were also working remotely. So sometimes, you know, it was that somebody hadn't even cited the child or the family, and that, you know, that was causing our clinicians a lot of stress and worry. So I think one of the other challenges for health clinicians was the fact that in terms of COVID restrictions, in terms of our inpatient facilities, so mental health and drug and alcohol inpatient detox units, you know, whilst they were still in operation, it was limited operation, and there was also kind of, I guess, a priority in terms of not those people remaining in hospital if it could be prevented in terms of, you know, start limiting that impact of COVID in terms of staff and patients. So the impact of that has been a lot of pressure and stress for our community clinicians. So, you know, our mental health, drug and alcohol, child, youth and family, all our community services have really experienced an increase in referrals during COVID because, you know, of the need to have more people at home as opposed to in institutions. So I'm just going to turn over my page so I don't miss anything. Yeah, just continuing on from that. So, you know, our community organisations have really, you know, been under more pressure. Our sexual assault service reported a decrease in presentations to emergency department, you know, and they have questioned whether this is because police and perhaps community organisations or victims themselves have been reluctant to go to emergency because, you know, they may have concerns about COVID and their safety in doing so. So I guess just some really key messages from health that it is safe for women to come to our emergency department. The right COVID precautions are in place, and we very much encourage, if you're having reports of women experiencing sexual assault, that they do come and access that support. So I sort of started with the challenges for health during this time, but what I'd really like to highlight, a little bit similar to what Alana was talking about, is whilst health has had tremendous challenges, obstacles and pressures, health have done an amazing job in terms of holding vulnerable families during this time and going above and beyond in their practice to reduce the risk of harm that families may be facing. You know, as I mentioned, what I'm bringing here today is direct consultation and work with our health services across the district, and what I've observed in my role as domestic violence officer. So the increased isolation restrictions, as we've all been talking about today, has meant that a lot of women experiencing domestic violence have been under increased surveillance by their partners, and their opportunities to access support has been restricted. So in terms of health services, like while it may not have been possible for them or safe for them to respond to a call at home or to access a domestic violence support service from home, they have been able to go perhaps to an early childhood clinic, they've been able to go to an emergency department, or they've been able to access a mental health or drug and alcohol clinician. And what this has meant is it possibly has been the only opportunity to talk to someone about what is happening at home and to receive support and referral information. So our health clinicians have really done an amazing job in terms of meeting those women, finding creative solutions around that to provide support, reassurance and comfort to them. Sometimes these women have come to them in crisis, and other times they've just needed connection. They have provided our health clinicians, you know, the opportunity to talk, but they've also given clear messaging around the fact that all the local domestic violence support services are still very much in operation and that you're able to refer to them. Yeah, I just have heard some really amazing stories in terms of when I've been talking to a lot of services and supporting a lot of services. We heard from our family support services some really creative solutions. You know, they've been receiving calls from women who haven't been engaged with their service for some time, who've reached out to their service because they've been experiencing violence at home or emotional abuse or psychological harm. And I guess that's a real reflection of the relationships and the rapport and connection that our health services across the district have, built with these women across the work that they've been doing. And some of, I've heard some really creative solutions in terms of these workers offering to meet these women in a park and just do laps with them around the block whilst meeting, social distancing, which has been an amazing intervention for people who may not have had any opportunity to reach out or talk to anyone. So, hats off to our health clinicians been doing such a great job. The impact of COVID-19 on clients experiencing mental health and or substance misuse has been greatly minimised as well by the dedication and support of our community workers. So whilst there definitely are reports of increased mental health concerns, there's been a lot of women presenting to mental health services with emotional dysregulation, which, has been an indication of violence they might be receiving at home. And there has been reports of substance misuse and relapse, but I guess just to highlight as well, the mental health, drug and alcohol, gambling clinicians have also been doing a lot of proactive work in terms of really looking at who's on their caseload, looking at who might be most vulnerable, who might be most at risk of relapse or deterioration in their mental health. And there's been a lot of proactive work being done in terms of looking at how they can increase engagement with these particularly vulnerable people to ensure that the risk of harm to these families is minimised. Sorry, just turning the page again. And I guess just to touch as well, as whilst COVID has provided opportunity for perpetrators to increase tactics being used to perpetrate violence against women and children, it has also actually been able to be used by health clinicians to create the opportunity to see women without alone in compliance with COVID restrictions. So, we've had some clever clinicians and some COVID restrictions has really helped us. For example, when women have come to early childhood clinics with their newborn babies, it's a little bit, wait here, mate, like, she needs to come through alone, and or going to antenatal services to have their scans at 20 weeks, that you can't have anybody come through with you. So COVID has provided a strategy for a lot of health clinicians. I know it's also been used as a tactic for a lot of harm, but there has been some good work being done to try and access and provide women support. And I think equally, whilst, some women have also, we've heard stories using COVID to their, as an opportunity to self-isolate from perpetrators too. So they've been able to use that to keep them safe as well. So yeah, in my role as the domestic violence officer for Northern Sydney Health, I've really worked alongside these healthcare services during this time, providing consultation, support and supervision, and just really observing the great work and response that they're doing. Sometimes my role has really just been about allowing clinicians the space to debrief about gaps in services or disappointing outcomes for their clients, when they've encouraged them to access support and perhaps it hasn't been the best outcome, or maybe they haven't got the best response from police. I've observed and heard many stories about the dedication and commitment from our healthcare clinicians in supporting vulnerable families during this time. Our service has continued to work really closely with our healthcare clinicians as well as our non-government partners. We've been doing a lot of work in terms of making sure our health clinicians have the most up-to-date information about what services are available. We now have an intranet site that all our health clinicians can access. It's got all the latest information about changes with COVID, and how they can access all the support services that are here today. We've also done several webinars. We did one internally not so long ago as well, and it was really about just, bringing that message home that help is available. Women, these are your local support services. They're all really keen to help and support you. Please help your clients to call these services because these support services, although remotely, still remain in place. Yeah.
Oh, great. Thanks for that. Glad you brought some of those other things like gambling, because that was something that had come up in some of the questions. So obviously the support continues. There was another area that we've had quite a few questions about, and that was about elder abuse. And I wonder if you could just give us a bit of an idea of how things are going with that and how the current situation has impacted those affected by elder abuse.
Yeah, sure. Look, again, the elderly population have been a really vulnerable population during COVID. As we know, anyone over the age of 70 was encouraged to stay at home. And as we know, as relatives, it was really difficult for us because we were all told not to have contact with our parents and our grandparents, and that has created a really difficult time for our older population, and there was also added obstacles in terms of GPs weren't able to do home visits, geriatricians weren't doing home visits, our rapid response teams from emergency departments weren't available to do that work in homes. And also you've got the added complexity that older people were told we were encouraging them not to come to hospital. So some of the biggest issue for them was obviously isolation and neglect of their care. From talking to our aged care community teams, what happened as well is a lot of people took their elderly relatives out of residential care because they were concerned about them contracting COVID, but the impact of that is that they didn't have the care available to care for them at home. So that meant, again, that there wasn't the right amount of care there for them. Older people also became more vulnerable to, say, financial abuse or like accepting help from strangers, because I guess, being so isolated and not having their usual support networks available to them meant that, they were a bit vulnerable to perhaps people offering to do shopping for them or to do things, and that has created a real issue for them. And, I guess in terms of people needing to put their loved ones in care too, that's been a difficult time. So again, just to really highlight, from hearing from these clinicians working with this population, again, they have gone above and beyond about trying to hold these people, these vulnerable older people in this space. They've definitely had an increase in referrals and have spoken about, like, I guess the biggest issue being neglect during this time. Yeah.
Yeah, thanks for that. And then I guess our last question is, what do you see as the main challenges to health services as we start to ease off the restrictions?
Yeah, so look, one of the main challenges for health clinicians currently is, I guess, being able to meet the demands for service. So, as I've mentioned, there's been definitely a big increase in referrals to our community services and also to so adolescents has also been a really vulnerable group during this time. There's definitely been increased conflict, like parent-child conflict, also conflict around, adhering to restrictions, and, there's not the usual outlets available for these families to minimise the harm of the COVID restrictions in terms of going to school or going to work or talking to peers. And in fact, our police report that the biggest call outs they've had have been to homes where there's been adolescent sort of conflict with parents. So, so our services, so child, youth, mental health services, they're definitely very, very busy. There's increased concerns around, young people's mental health, and what's already been reported in terms of tensions at home and families, like people losing jobs, schools, so, and also our child protection counsellors doing an amazing job. Like, there's just been such an increase of referrals, and I guess the concern going forward is looking after our health clinicians too. I mean, for them, it's been a really challenging time too, having to adapt to the changes, but also perhaps having their own sort of challenges going on, like with looking after kids or homeschooling or or what's happening. And I guess just, you know, during this time, I've really found that we've all really come together in terms of health clinicians and our community partners, but going forward, that's going to be more important than ever. Like, as we see some of these subsidies start to, you know, say JobKeeper or free childcare is about to end, is that, I guess there's concern from health clinicians. Are we going to have a new wave of referrals in terms of need for help? And also, whilst we've been able to maintain engagement and support people over the phone, as we all know, there can be so much more going on in somebody's household than perhaps we've known about. So yeah, I guess there's just concern that, you know, we've had a very, very busy time and we've definitely seen an increase in referrals, but going forward, it's going to be more important than ever for us all to collaborate, for us all to work together, for us to have conversations around, you know, how we're going to meet people's needs. If our service can't meet them, who can I refer them to? How can we all work together to make sure that we're meeting all these vulnerable families' needs?
Yes, I think that's really, really absolutely right. We've got a little bit of time for questions. If there were any, Maria, that we could ask Brooke?
None have come through yet on the chat, so if you have any questions that are burning, feel free to put them on the chat. I did have one though from someone from InHealth, just wanting to confirm, like, sorry, Brooke, you've talked a lot about how well the health department has been managing, and it's been lovely to see that happening. Everyone has been so proactive in getting ahead of things and being intentional about contacting people that they felt were vulnerable and being creative about connecting with them and getting them the support they needed. On the other side of it, can you just revisit what are the reporting requirements that a nurse would have, or someone in health, or even the general community of services, if an adult discloses a DV assault or situation but refuses consent to report to the police or any other service?
Yeah, sure. You know, we have the domestic violence identifying and responding policy within health, and it has got very clear guidelines about when you do need to report in terms of if there's serious injury, threats to kill, and you know that we do have to do that if the woman doesn't consent, and especially if there's children in the home, then it would also become, you know, a report in terms of child protection and the helpline. We also have, and I guess that's where our service is very available to health clinicians in terms of, I know I'm saying that's what the policy is. We're also very aware that does present a lot of complexity to health clinicians in managing the risk, especially when the woman's not consenting. And there does then need to be a lot of work done around safety planning and work, and perhaps engaging other support services to continue that work that needs to be done. So yes, please do contact us, because we also have the safety action meetings which have been brought up today. We have the new piece of legislation, which is the Part 13A of the Crimes Act, which means if there is serious threat to women, they can be referred and discussed on that meeting and get an interagency response about how we might reduce that threat of harm for that woman. But yes, very much, you know, we do have mandated requirements to report as health clinicians in relation to, especially with child protection concerns and very serious domestic violence. Yes.
Thank you very much.
But yes, again, please do call our service and talk it through, because we know it's not easy either. Yeah.
Thank you.
Thanks, Maria. Were there any others, just any other general questions that have come up today that we wanted to put to the panel that we haven't covered? I think we've covered everything pretty well, haven't we? Yeah.
Yeah, I think we have. No other questions have come through on chat. But yeah, I think we've pretty much covered everything.
Fantastic. Well, that was the final part of our webinar today. So thank you so much, everybody, for joining us. And just reminding you again that the link for the follow-up survey is on the chat line, but we will also be emailing that out to everyone. And it's a 5-minute survey, SurveyMonkey, very short, but it's really, really helpful to us to get your feedback about today, because obviously, any feedback we get will really help us to improve any future events and something that we might be looking to run. I think we found this has been a really interesting experience putting this together and being able to talk to all the services and how much we really appreciate all the speakers coming today. It's been absolutely fantastic. And the information provided by all of you has been invaluable. It's been fabulous. A big thank you also to Deirdre Pinder from Diversity Services Department of Communities and Justice for her expertise and for providing our tech support, which we couldn't have managed without, I have to say. And also, of course, I want to thank my fellow organizers for making this collaboration possible. That's Adol Tekpini from Diversity Services Department of Communities and Justice, and also Maria from Relationships Australia. So thank you so much, both of you. It's been terrific. We'd also like to acknowledge the valuable contribution of the Southwest Sydney Domestic Violence Committee. Some of you may have attended the first webinar a little while back that they ran, and it was really because of that spurred us on to thinking maybe we should try and do something similar for our area, and also because we're a bit further down the track. And so they were fantastic in supporting us in the planning. And we really appreciate that. So big thank you to them, and particularly Sam, Borka, and Rola Rifai, and all the members of that committee. And everybody, just please accept our appreciation for staying with us online for the duration of this event. We really want to thank you for that, and stay safe and stay positive. And bye from us.
Thank you, everyone. Bye.